So this is the nutraMetrix live national conference call where we pick a timely topic to speak to you about that's happening in healthcare. And this evening, we're going to talk about creating a win-win for patients and providers. So like I said, my name is Sarah Chigender, the National Sales Manager. I'm out of the Boston area, been working with nutraMetrix since 2006. Love nutraMetrix because it really is a complete suite of customized cutting-edge solutions exclusively for health professionals. And we do a wide variety of products and services, some that we might even touch upon in this call tonight. We're designed to better serve patients and also to generate ancillary income for the practice because healthcare keeps on changing. So we're bringing you relevant information, training and products and services. We've been doing this since 2014. It's a $40 million division of a bigger company that's been around for 25 years. And we believe that patients should have access to recommendations for healthy living and access to products that promote optimal wellness from their trusted healthcare professionals. Because that's what the studies are showing, that they want the information directly from health professionals, registered dietitians. They want it from people that they trust, like, and know. And everything we do is focused on helping health professionals implement customized wellness programs that benefit the patients and the practice. And we do this with science-based nutritional interventions, revolutionary technology, wellness-based education systems, and trained implementation consultants. And so you might either be one of our consultants on the phone tonight, or you might be a health professional, and you might be either looking at this or you are evaluating it, or maybe you're already working with nutraMetrix and you're just excited to hear this training and be with us this evening. And either way, we appreciate it because we're changing the face of healthcare one professional and one patient at a time. And so tonight I have Dr. Carrie Cipino. Dr. Cipino, she's been in private practice for over 20 years, which is becoming quite unusual in the healthcare landscape. She has practices both on Long Island, New York, and in Manhattan, and she's one of 1,000 doctors worldwide achieving diplomatic status on the American Chiropractic Neurological Board, the ACNB, with over 1,000 hours in chiropractic neurological coursework, along with being board certified in neurofeedback. Dr. Cipino, I can barely even say that, so it just sounds impressive. So you'll have to tell us a little more about that. But we know that you're utilizing nutrition daily in order to assist your patients in achieving optimal health and wellness. And I know we were chatting before this call about, some of the trials and tribulations of being working moms, the both of us. And so I appreciate you taking your time out. Thank you so much for being on with us tonight.
Oh, well, thank you so much for having me, Sarah.
And so tonight, what am I talking about when I'm saying, I asked you to be on this call, Dr. Cipino. I said, we're going to talk about creating a win-win for patients and providers. But what does that mean exactly? I decided to define it. I think that right now, healthcare, it's a two-sided coin, and modern medicine, I just experienced it myself, and it's brilliant in so many different ways with technology and advances. But let's talk about what's going on right here in the United States. We're spending 2 to 4 times more per person on healthcare than other countries.
Right.
That's unreal to me. It's 20% of our economy. So that's okay. That's great what's going on. But health professionals are struggling to make ends meet. I don't know a lot of people who have been in private practice for over 20 years. I can think about even the doctors in my own hometown right here outside of Boston. And a lot of the doctors that I knew or heard of growing up have either retired or sold their practices to the hospital or joined a bigger group. And this is probably because of drug costs, declining reimbursements, legislative change. And patients aren't pleased. They're not pleased with, I like to call it, it's almost like the RMV or DMV of healthcare, where it's, 15 minutes and you take a number and the wait time's pretty long, and they don't like how they're being treated within the system and the lack of time that they have with providers. So, you being in private practice, being successful, we really want to hear from you and how you're making this work. So I don't know if you want to just start, Dr. Japino, if there's anything in particular that you want to add about your background that maybe I missed.
Yeah, in my practice, we see traditional chiropractic patients. So we'll see the patient who has pain or headaches. And then we'll also see patients who have neurological needs, like kids with ADHD, children with autism. And over the years, of course, healthcare is constantly evolving. And I feel like as a practitioner, the thing that we need to do is we need to constantly evolve our practice to serve our patients. And we all know, it's very well established the need for supplementation. And I came across so many moms who would sit across the desk from me and say, my child is on the spectrum or my child has these challenges and I know that I should give them a multivitamin. So I went out and I got them this really excellent Flintstones vitamin for them. And I'm really trying to do the right thing. And these are people who are really trying to focus on helping their children. And unfortunately, I'm sitting here across from them, seeing, Flintstones has the artificial colors, artificial flavors, has sucralose in it, for God's sakes. So it's one of these things that I felt like as a practitioner, I had a responsibility to educate them. So it's, certainly, of course, having the ancillary income from having supplements in the office is always a plus for the healthcare practitioner. But for me and for our practice, we saw these people coming in and we wanted to educate them so that they could, if they were spending the money, that they were actually going to what? Do no harm, right? That's like the Hippocratic Oath that we take this oath that we don't want. The first thing we don't want to do is to cause harm. And the truth is we know that artificial colors and flavors are neurotoxins. And so they're giving their children neurotoxins and they think they're doing the right thing, right? So that was when it became very clear to me that I had to have a solution for patients. I needed to be able to tell them this is what you should take and this is why you should take that. And nutraMetrix helped fill that void for me.
Yeah, so let's talk about that. Because a lot of healthcare providers that I talk to, they feel limited in their scope of practice, whether it's due to reimbursements or it's due to education. And you touched upon it. Chronic disease is huge. And what we can do right now is to help, especially families and our newest generation that we have and what's going on with kids. And sometimes that's the motivating factor, which is great. But there's a gap in healthcare that we're seeing, and I do feel like it is this nutrition piece. And so tell me a little bit, about like some of the results that you're having within your practice in having a solution, in having an answer, and being able to talk to moms about something else.
Yeah, it's very well documented the use of things like omega-3s for children who have neurological challenges, including, probiotics for the gut. A lot of these children have very limited diets. They're not able to absorb nutrients the way we'd like them to. And people are looking for solutions. So, inflammation is one of the biggest things I see in my practice for the chiropractic practice. For people who have pain, for example, people who have that chronic inflammation. If you think about just about every disease has a root cause of inflammation. So, giving patients specific supplements to reduce their inflammation is huge for the practice. And that's what patients want. They want the results. And so they're here, and I just feel like as a practitioner, I have a responsibility to educate them and to give them specific recommendations based on whatever conditions they have as they present themselves to me. And in how healthcare has been evolving, it's the declining reimbursement rates put you in a position where you might not have the amount of time that you'd like with your patients. And I have found that introducing nutraceuticals into the practice gave me enough of an ancillary income where I could actually sit down and practice the way I'd like to practice, which is spending that time one-on-one with the patient, educating them on their food choices, educating them on whatever nutritional supplementation would be helpful to get them to where they want to go. Because the truth is 70% of the patients that were walking in here were already on these supplements, but they were picking them up at Walgreens or Costco. And again, they're not going to be able to get that kind of the same kind of quality, of course, that nutraMetrix provides.
But at the same time, I mean, let me play devil's advocate across the table here and say, you know, you're putting your reputation on the line whenever you affiliate or align yourself with a certain brand, a certain company. And that's another thing I hear is how, I don't know if I can do something like that. I don't know if I want to bring on, you know, someone almost like a partner. I feel like when nutraMetrix comes into an office, especially with how closely you work with your own nutraMetrix consultant, we partner with you. And, you know, there is that. You're looking for cash flow. You're looking for alternatives for patients. But it's a journey to decide to offer an alternative stream of income. So how did you evaluate bringing nutraMetrix or any other streams of income that you have into your practice? And how does it help you be a better practitioner, and how are patients responding? Just tell us a little bit about that journey from the business side of things.
Well, let me just quick start with the clinical side. You know, originally when I first introduced nutraceuticals into my practice, I used a different line because I wasn't even aware of nutraMetrix. And what I found is I would have my front desk take a look at, you know, back in the day of ledgers, paper ledgers, and they would say, wow, you know, this one didn't reorder their multivitamin, or this one should be out of this supplement, but they haven't asked for it. So I would say, you know, just at the desk, just ask them, you should be ready for your multivitamin. Can we get that for you? And the multivitamin I was using at the time was actually a pill, and they had to swallow 6 pills to equal their solution for the day, okay? And what
Wow.
the feedback was, you know, I don't really feel a difference if I take it or I don't take it. So I didn't necessarily want to continue on the supplements. And that really, you know, made me feel as a practitioner not so great, because here I am recommending a supplement that has all, you know, great GMP certified, you know, definitely a good quality supplement. But again, it's in a pill form. So what, as we know, as nutraMetrix providers, like, what is the difference in the science of the deliverability, which is really, you know, where we get the best results. And so at that point, another colleague of mine, another chiropractic neurologist, said, you know what, Carrie, I was introduced to these supplements, and I really think that you should check them out. And I have to tell you, you know, being from New York, you're a little bit of a skeptic. And I said, you know what? Why don't you give me? It's just part of the lay of the land here. So
I married a New Yorker. I get it. Yeah.
Okay, so you know. So I said, you know what? I'll take the joint support from my mom. I'll take the female support for my friend who's going through menopause, and I'll take the antioxidant for myself, and then I'll get back to you. And all three, you know, my mom felt a difference right away with her osteoarthritis in her knees. My friend's hot flashes went away, and I felt like I never had more energy than I did on the OPCs. So at that point, I said, okay, let's do this. And what I really loved about nutraMetrix is, as I've been involved for over 10 years now, the science, as the science comes out, our formulas change. And I think that's huge, because very often you'll see these formulas in other companies stay around forever before they start to rise to the current science. And that really made a big difference for me as a clinician, that as I was able to say, hey, listen, these formulas are constantly evolving based on the current research. So that's from the clinical side. From the financial piece, of course, when you're providing, you know, supplements that are isotonic, you're getting better results. Patients are feeling a difference. They're seeing a difference. And so my sales of nutraceuticals quadrupled after 30 days. And it quadrupled not because my patient base quadrupled, it's because the patients came in that I had seen that first month and repurchased their next month's supplements, and also said, hey, listen, you know, I'm so happy you gave me this multivitamin, but do you have a calcium that's a powder? Do you have a B complex that's a powder? And so this is the days before the beautiful daily essential packets. And so it was great because I was able to offer them a complete isotonic solution. And because they felt a difference, they were willing to repurchase that and get on the supplement. So.
I mean, and that's the proof right there. And especially when you're working with families, and I mean, if they're putting their time and effort and energy into and money into repurchasing, then you're like, okay, we're on to something. So I've heard that, but I do appreciate too, that a lot of the practices and providers that I work with, their journey started exactly like yours did, Dr. Chapino, where they say, let me try it for myself first. So if you are evaluating this, I would say that's an important first step, and a lot of people. But let's just touch upon, because you speak so well about nutraMetrix, and I know because I think you've been following me around the country and doing lots of education with us, and you really take the time to make yourself knowledgeable so you can have a conversation with your patients and have that education base. And most traditionally trained medical doctors only have one course, some as small as one lecture in nutrition or anything that resembles prevention, which is just terrible. And on the other hand, what are patients doing? They're relying on resources like Facebook, magazines, television, rumors, old wives' tales to make important preventative diet and lifestyle decisions. So could you speak a little bit to how has nutraMetrix helped both you as a practitioner and your patients in getting appropriate quality information to make decisions?
Well, of course, the nutraMetrix programs that they have, we just went to one in Niagara Falls. The education that they provide there in a weekend is phenomenal. And they touch, Dr. Deirdre Mason, also does these great Facebook Live videos within the Facebook groups. And that's a really great way of getting tidbits, learning more. So I really like what nutraMetrix provides for you. Of course, it's very important to get to these things at least, I would like to go at least once a year. But now you guys have even made it easier by offering these online summits for those of us who are moms and have difficulty traveling sometimes. So that was really great, introducing the online summits. But they also have great PowerPoint presentations that you can present in your office. They also have great patient handouts. And in our office, every time a patient purchases a supplement, we provide the patient with the product handout, because I think it's really important for them to understand why they're taking a supplement. And if they don't read it, maybe somebody in their household will read it, right? So it's always good to get the information out there. And the other thing that nutraMetrix provides is also these videos that we use on a loop tape in our waiting room to educate our patients. It's a great way just to have it going on in the waiting room, and patients, it starts the conversation. So if patients weren't sure whether or not I was a specialist in nutrition, they're certainly going to ask me once they've viewed it in their waiting room. So as a practitioner, certainly the NEI courses and the NC trainings are great for, people who want to become nutraceuticals consultants. And then for your patient resources, having these PowerPoints, having these videos, and then the power of the Facebook group is really one of my favorites. So that if you have a question, or if you have a patient that you come in and you're a little confused, you can pop into the Facebook group, and Dr. Mason is very prompt about responding to you so that you have an answer for the patient that's in hand. So.
And I love that you bring that up, because I do think that these Facebook groups, and it's not just Dr. Mason, I've heard from other providers that they're very excited because you could get feedback on a clinical case study and have a physical therapist weigh in, a chiropractor weigh in, a naturopathic doctor, a surgeon. The peer-to-peer from a multidisciplinary standpoint is pretty amazing. And to have that for the account that you set up, we just talked about, I wish the whole thing was more expensive. We have made it so it's so affordable to work with us with nutraMetrix. And it made me think of last week. I was talking to a provider, and I said, I can't believe a few years ago, I was in a BNI, a Business Networking International Group. And when all is said and done, it probably cost you like $1,000 for the year or whatever to be part of a BNI. And there was a chiropractor. in the group. There was a licensed massage therapist. I visited other groups that had dentists, that had even some traditional medical doctors. One had a pediatrician in it. And you get up every Thursday morning and you go and you do your networking spiel and the whole thing. And it was like, it's a lot of work and you're not even sure what your return is going to be. And something like nutraMetrix, I mean, day one, you're getting so much value from the education, from the peer resources. I just think it's phenomenal. And people don't understand the value in that because it is priced so affordably as a franchise-like solution. And I mean, I know that you love nutraMetrix, and I know you love the brand, the company, the movement, because you are taking time from your family, out of your schedule, away from your clinical practices, to promote it to colleagues as a viable option for them to add to their practices. So, I mean, not only, Dr. Serpino, have you put your stamp of approval on it within your own private practice, but now you're going ahead and you're telling people about it, and that's putting yourself out there. And again, I mean, something that other practices sometimes are a little hesitant to do, or practitioners. And I get it. I mean, your reputation is everything. But if you could just sum up our topic, because if you feel that passionately about it, I mean, which I know, because I know you and I know how you talk about nutraMetrix, but just for our guests on the call this evening, could you really sum up how nutraMetrix is truly a win-win for both providers and patients in today's healthcare climate?
Sure. I mean, I think, for me, certainly seeing the clinical results with my patients makes it a win-win for both of us, right? I'm recapturing those wellness dollars into my practice that they were spending, and they were not getting quality supplements, right? They're buying these Flintstone vitamins, for example. And for the patients, they're able to have a supplement that's going to improve their health. As far as sharing it with others, the beauty of nutraMetrix is that if for an NC who's working with another doctor, if that doctor is not comfortable or doesn't want to necessarily refer others into the program, they don't need to. But I will tell you this. Once a doctor's utilizing it in their practice, once they're utilizing it for their own families, I would say it's more common that you end up having these people say, hey, you know what, my friend's a radiologist, my other friend's an orthopedist, and you know what, I'm getting really great results with this. So don't if they don't want to know about the referral program in the beginning, just let it go. But I guarantee that over time, once they start seeing the results with their own patients, they probably will be talking about it and sharing it with others. And that's really what happened with me. I was using it in my practice for a long time before I really decided to share this message with others. Because you know what? These other companies that are around, I'm not saying that there's not other great supplements out there, but our delivery system is unique. Very often people will say, oh, well, there's a lot of competition out there. And I said, there is not. We have isotonic supplements. There is not a lot of competition out there. We have the most comprehensive line of isotonic supplements, and we know that improves deliverability. So if we can improve that, then we can improve a patient outcome, and we can again recapture those wellness dollars into our practice. So that's, for me, where the win-win is for both the provider and the patients.
You just summed that up so perfectly. So, I mean, I can't, there's nothing that I can add to it. I mean, other than you're right, like whether you decide to, work with referrals or not, but when you feel so strongly about something, and when you're seeing the way that healthcare is going, and that providers and patients alike are being, the system's just failing them on both ends of the spectrum, it's hard to not be excited when a solution works for you. And so we encourage that if you feel so inclined to work with us in spreading the movement, this wellness movement, that's great. And we have ways that we can help you do that. And if you just want to, use it with your own patients, that's great too. And if you're really just starting out and you want to just say, hey, let me do a study of one and try it on myself or include my family in that, then that works just as well, and that's encouraged. And so wherever you are on that spectrum, we just encourage people to get more information, get information about nutraMetrix, get information about the delivery system. And just to touch upon nutraMetrix, it covers supplements. It does cover a clinically supervised weight management system, TLS Select. And we also have a nutrigenomic product. We have a partnership with a lab. It's called GeneSNP DNA analysis. And we have education behind all three of those legs that are all housed under nutraMetrix, whether it's online, in person, or our format like our new online summits that are going really well, that everyone's responding really great to, and then integrating it into the practice. So again, Dr. Ciappino, just thank you so much again for your time this evening. I know time is the only commodity, right? We can't make more of and we can't get it back. So, I appreciate that. And because I do know just how excited you are about what's going on with nutraMetrix right now, and that you are excited to share this information with people. So any final thoughts, Dr. Ciappino, before we say goodbye?
You know what? I just think that if you remember as a practitioner and as an NC that you are serving people. And if you just keep focusing on the patient and keep focusing on, bringing something to them that's better than what they already have in their cabinet, you can get really passionate about it because you're providing a service. You're providing a service for people who really need it and they want it. So just to keep that in mind, if you're approaching doctors and if you're considering sharing it, there's no better product out there.
Thank you. And we're proud of the team that we have, that we've put in place to be able to bring that to you and to bring that to other practitioners around the country. So thank you so much. This has been it's an amazing topic to think about, creating a win-win for both patients and providers. And I thank again Dr. Carrie Ciappino out of New York for being our guest this evening. Again, my name is Sarah Tegender, National Sales Manager with nutraMetrix, and I wish everyone a great evening. Thank you so much.